Medication prescribed by a doctor can be a literal matter of life and death for a significant number of depressed patients. There are many non-medical approaches to treating some of the signs and symptoms of depression, and many of these can be just as effective as taking medicine prescribed by a doctor. If you suffer from depression, you may want to try treating it naturally without the use of medication, or you may want to consider adding additional treatments to your current antidepressant regimen. Today's video is about 7 ways to overcome depression without medication. But before starting this video, give this video a big thumbs up and subscribe to my channel for future updates. 7. Get more sleep. The quality of one's sleep directly affects their mood. If you don't get enough of the former, the latter is almost certain to suffer, regardless of whether you already suffer from depression or not. Make sure you practice what experts on sleep refer to as excellent sleep hygiene in order to help support your mental well-being. This indicates that you maintain regular bedtimes and wake-up times, that your bedroom is set up for sound sleep, that you have a peaceful bedtime routine that does not entail sitting in front of a device and other similar behaviors. The connection between getting enough shut-eye and feeling better mentally can be a convoluted one. Not only is it possible that insufficient sleep plays a role in the development of depression, but it's also possible that depression might cause poor sleep quality. There are a number of things you may do to try to enhance the quality of your sleep, regardless of whether you have trouble falling asleep or staying asleep for longer periods of time. Before going to bed, make sure you give yourself time to decompress by engaging in an activity that you find pleasant and avoid any stressful thoughts or responsibilities. Every night, go to bed at the same time, and every morning, set your alarm for the same time so that you can wake up at the same time. Establish and stick to a regular pattern for going to bed. Turn off all your electronic devices and spend some time reading a book instead. 6. Reduce your intake of caffeine. Caffeine can be found in beverages such as coffee, tea, soda, and even chocolate. Caffeine shouldn't be used after 4 o'clock in the afternoon if you want to be able to get a good night's rest. If you like coffee, it's acceptable to have a moderate amount of it in the morning, though. If you find that you are dependent on caffeine, you may want to try gradually reducing your intake in order to avoid the uncomfortable symptoms of caffeine withdrawal. Instead of giving in to your cravings for a soda or a cup of coffee, try going for a stroll around the neighborhood for a few minutes. 5. Get more vitamin D. There is some evidence to suggest that a deficit in vitamin D may have a role in the development of depression. In the event that your diet and other aspects of your lifestyle, such as sun exposure, do not provide you with an adequate amount of vitamin D, discuss the possibility of taking a supplement with your primary care provider. Certain vitamin deficiencies can have a role in depressive symptoms. A supplement might be helpful for you if you find it challenging to spend enough time outside, or if the weather is frequently cloudy and prevents you from getting adequate sun exposure. 4. Develop your sense of spirituality. There is no requirement for you to join a church, synagogue, or a mosque unless you desire to do so. However, many people who are coping with depression have found that religion to be an effective source of support. Simple activities that are performed on a regular basis, such as meditating or adding to a list of things for which one is grateful, can help improve one's mood and general sense of well-being. The practice of meditation has been shown to provide a variety of health benefits, including reducing levels of stress and assisting individuals in being more self-aware of their thoughts and behaviors. Research suggests that an approach to treating depression and preventing future episodes of the condition, called mindfulness-based cognitive therapy, which combines aspects of cognitive behavioral therapy with mindfulness meditation, can be helpful in both treating depression and preventing future episodes of the condition. According to a number of studies, certain types of mindfulness contemplative techniques may also be useful in the treatment of depression. There are a great many approaches to meditation. However, if you want to begin with something straightforward, you can follow these instructions for a simple contemplative exercise. Relax and take a seat. Close your eyes. Take normal, deep breaths. While you are breathing, bring your attention to how your body feels. When you find that your mind has wandered, bring it back to focusing on how you are breathing. Well, do you like what you're seeing so far? Don't forget to like and subscribe. Keep watching because you don't want to miss what we have at the #1 spot. 3. Get more exercise. It is not necessary to prepare for a marathon in order to get more exercise. Nonetheless, it is necessary to participate in around a half an hour of low-intensity movement on a daily basis, since this has been demonstrated to be useful in enhancing both one's mood and one's quality of life. Even better, take it outdoors. People who suffer from seasonal affective disorder, also known as SAD, benefit greatly from the therapeutic effects of exposure to natural sunlight and fresh air. Even though studies have shown that engaging in regular physical activity can be helpful in the treatment as well as the prevention of depression, it can be challenging to begin a new exercise routine when one is experiencing despair. It's possible that your low mood, a lack of energy are signs that you're simply too exhausted to get up and do anything. Here are some things you might attempt to help you maintain your routine. Enlist a friend. At least a few times per week, enlist the help of a friend or family member in an activity such as walking or another sort of physical activity. When you're going through a tough time, having the backing of a friend can not only make it easier for you to stick to a schedule, but it can also make it simpler for you to keep your social relationships intact. Bring the positive outcomes back to your memory. Beginning is difficult, but moving forward is something that will make you feel better in the long run, so put in the effort. Start small. You may start by walking for just a few minutes every day, and then gradually build up to longer periods of time. 2. Avoid alcohol. Alcohol is a depressive substance when taken by itself. Drinking might make it more difficult to fall asleep. And getting sufficient sleep is one of the most important factors in overcoming the blues. Alcohol, despite the fact that it may seem like a quick fix to escape what you're feeling, may really make many of the symptoms of depression feel much worse on the individual who is drinking it. Not only that, but it can lower inhibitions, which can lead to potentially unsafe behaviors and poor decisions that can have long-term repercussions. It is highly recommended that you abstain from alcohol completely if you're currently taking any kind of antidepressants. There is a negative interaction between alcohol and medication. Talk to your physician if you have been abusing alcohol or any other substance and require assistance in kicking the habit. You may potentially be suffering from an addiction to alcohol or another substance. Because the symptoms of withdrawal may temporarily increase feelings of depression, you may want additional assistance while you're going through the process of recovery from your addiction. 1. Transform the way you think. Despite how Pollyanna-like it may sound, having positive thoughts might actually make you feel better. Your state of mind can be directly influenced by the thoughts that you think. If you find yourself unable to shake off pessimism on your own, consulting a therapist may be beneficial in teaching you how to do so. Cognitive behavioral therapy is rapidly becoming recognized as one of the most promising and widely utilized treatments available for the treatment of depression. The primary goal of cognitive behavioral therapy is to help patients recognize destructive thoughts patterns and then teach them more constructive ways of thinking. There are many various approaches that you can take in order to put some of these concepts into practice on your own. So, that's it for today's video. What do you think of the #1 spot? Hit us up in the comments and let's chat. Don't forget to like, subscribe, and turn on the notifications for our channel so you never miss what's coming next from us. Thanks for watching!